Hello, everybody, and welcome. Welcome to our third webinar, session number 3, Advancing AI, Custom Tools, Advocacy, Impact, and Future Opportunities. Hello, everybody. My name is Andrew Spiegel. It's my pleasure to welcome everybody to this really important third webinar. Next slide, please. I am the current board chair of the World Patients Alliance, and it's my pleasure to welcome everybody here. Today we have our great speaker, Ravi, who's going to finish out our three-part series. Just a quick reminder to everybody that we can present this in your own language. We have multi-language broadcast, and if you look in the chat, you will see that there is a link to Wordly, and you simply click that link, select your language, enter your name, and click attend, and everything will be in your own language. So that's a really great feature we have for these webinars. Next slide, please. So who are we? The World Patients Alliance is the largest nonprofit umbrella organization working across all diseases. We have more than 700 patient organization members, and we work to ensure that patients have an active role to play in all stages of healthcare. You can find out much more information about our organization on the website. I won't waste time talking about it now. We have too much important AI stuff to talk about with Ravi soon. Next slide. Just a quick note that we do have 707 member organizations from 138 countries. You can see in the lower part the really good geographic representation we have of the whole world. Next slide. And one thing I want to remind everybody is that soon you'll be hearing about our conference that we'll be scheduling for next November. And stay tuned for information about that. Mark it off your calendars. Watch for our information on that. But between now and a year from now, we'll have tons of information for everybody. So let's jump into today's really important session with Ravi. Ravi and I spent a little time at our European regional meeting. We had dinner in Lisbon, Portugal a few weeks ago. And I mean, this guy knows AI more than anybody, any of us know. The ideas that he has for all of us to make our jobs easier, to run our conferences better, to run our programs better. They're really game changers. So with that, I want to turn it over to Rodney, who's going to do a recap of our last couple of sessions. And all of those are on YouTube, by the way. Go to our World Patients Alliance YouTube channel. I'm sure they'll post the link in the chat. And check out our first and second webinar if you haven't caught that yet. But then Robbie's going to talk about what's new in the AI world, custom AI tools, content automation, building confidence through experimentation, and what is coming next for our patient groups. So next slide.
Now it's Ravi's turn.
That's me, yeah. Perfect.
Great. Okay, Robbie, thank you so much.
Thank you very much for those kind words. What a year it's been. I'm Ravi. It's nice to meet you all. I'm hoping some of you have been along for the previous two. For anyone who's new and watched me online as well, welcome. It was particularly nice to meet people in person in Lisbon who had participated in these. And it's quite clear now. And if you haven't joined the AI journey, that everyone is talking about this. And I think that when we first set the themes for this, I never would have expected so many people to be using it so well, and it's wonderful to see. But there are some things that we didn't talk about before, and hopefully I'm going to open your mind even further today. So as Andy said, I'm going to go through a recap of the previous two to bring us back up to speed. There have been some fundamental changes in AI and health since we last spoke. So I'm going to spend some time on that so that you understand the consequences, because they're wide-reaching. And then I'm going to attempt to do something complicated, something advanced, and build something with you to show you the possibilities. And then I'm going to have a small section on content automation, because many people ask me the same thing, and I think it'll be useful for you to have it. If you can go to the next slide, please. Sorry, Aga, who normally does this with me, unfortunately, isn't with us today. I wish her well from her bed. She's sick. So you're going to have my voice. In the first webinar back in July, we demonstrated how patients had started to really use AI to answer their questions. it was quite clear that many people were using it to be like a virtual doctor or to understand symptoms and things a bit more. And it started to become very clear that the patient organization's role within this is to make sure that any information that anyone wants to find using an AI search is accessible, structured, high quality, premium. And that had an immediate consequence of every patient advocate in the organization to make sure that the information that is publicly available is as good as you want it to be, as good as it can be, and it is publicly available. Many things are hiding behind paywalls and private chat areas, etc. We showed you lots of different things: chat, images, translation, voice. Please go back and have a look. You can do so much here. It's not just, searching something on the internet. You can build things, you can make images, and you can make videos. And what's really important at all times is that you are in control of AI, and you are asking and using it as a counsel, and having very clear conversations, because AI is what you put in is what you get out, right? And we are only at the beginning of this. And so hopefully, when we look back at the YouTube videos in a year or two, I'm not too dated, and we have some new ones on, and we continue this journey. In webinar 2, we went through examples: letter building, letter writing, how to create voice, audio, etc. And we shared some prompts with you in order to make your content great and to make AI your real thinking partner as you work. One very important thing for all of us to remember in everything that we do is to make sure that we always keep our patients or our personal data private. We don't publicly share things that we shouldn't be, and we respect all of the safety, privacy, ethics of your local countries, and also general consensus is to keep things as private as you can when you're using individual people's things. So hopefully when you look back, the two webinars have shown you that AI is great, people are using it. The role of the patient organization is extremely important and increasingly important when we go on to the next slide, and that you can adventure and create lots of things. OpenAI is one of the companies that provides an AI platform for people to use. Throughout all of these webinars, we've not focused, on too much of which one you prefer or not. I use ChatGPT. I also know how to use the others. And a really important thing happened, and not everyone is aware of it. Up until 30 days ago, you could upload your information into ChatGPT, and it would give you almost like a diagnosis and potential treatment. And it was running a bit wild, and in many cases was giving people inaccurate information. AI isn't perfect. And so OpenAI has taken the step to change its policies, and it is now much clearer and is evolving what the role of AI will be within our sphere. And it is to provide education, to provide awareness. It is not to provide diagnosis and a replacement doctor. And so it's very important for everyone to know that what AI was doing up until recently is changing. It's changing for the good, because it's trying to protect people from receiving inaccurate advice. And one of the big consequences of this is the importance on patient organizations and patient advocates to be sharing information around education and awareness that can be helpful to others. We do that all day long. We are there at core to provide a support and information services for people in the industries that we work, whether they're patient carers, professionals. And what's happened is that it is no longer now going to act as a virtual doctor, which is a good thing for obvious reasons, but has some negativity as well attached to it, because in certain places in the world where there is no alternative, they're about to lose access to something that was a little bit better than nothing. And so as we progress on this AI journey, I think there's an important milestone that's become clear, that from now onwards, there is increased focus on the information that AI is using, and that is obtained from patient organizations, patient advocates, patient stories, and organizations like the World Patient Alliance. And so over the next few years, structuring content in order to make sure that people and patients get safer answers is at heart what's really important. And so the conclusion is that everything that we've been going through in our webinars still stands. It's just that AI is getting better and is going to be more careful in the way that it answers patients' queries, which is a good thing. That is only with ChatGPT at the moment, but we fully expect all of the other ones to start to adopt a similar strategy. And this is also happening in other areas like finance and law, that ChatGPT will not act as your doctor, lawyer, or financial advisor. And so those are the three sectors that have been chosen. So hopefully, some people who read this were alarmed that, oh, we can't use it how we wanted to. We can still do everything that we've been discussing, planning your campaigns, fundraising letters, organizing efficiency, and everything else. But it's very important for you at this point to note that AI is evolving. We are at the beginning, and big changes like this can happen. And this particular change is in our interests because it pushes the emphasis on people having the right information. So you can read all of that in detail if you want to, but I felt it was really important for us to communicate this because not everyone is clear as to what's happening. Can we go to the next slide, please? Yeah. I think I covered this, but AI patient organizations are critical to publish reliable health education. Publish things in accessible formats. PDFs are fine, HTML are fine, password access is not fine. Make sure that everything is structured and that you add disclaimers and safety messages, as I'm sure you will do, to make sure that everything is there. It's important, I think, to think of medium long term. And it's obvious that in the West, many patient organizations exist and have a lot of digital communication. That's not the case everywhere. And in certain parts in Africa, we look after one particular patient organization in Africa. It is really, really important that whilst their community isn't using that website as much, that they have a digital presence because they are educating the world in how a different type of person is experiencing symptoms and treatment and things like that. And so making sure that our digital world evolves with all information is really important. So I encourage everyone to have a think about all of the different information that they have and whether or not it exists digitally, because that is going to power up AI. Right, next slide. Move on to some more interesting things. We can skip this page. It's covered it twice, but this presentation is available for you afterwards. So I'm going to do a practical example, which we did in the previous ones, but this one is going to be a little bit more complicated. So I'm going to take a few moments to set out what I'm going to do and what I'm going to show you. Many people asked me about agents and things being done automatically. And how can we build things that are slightly more complex? So not writing a letter or creating an image, but actually doing something more complicated. So I wanted to show you all, if you wanted to have an experiment to build something advanced, how could we do it? And so what I'm going to show you is how I built a website that will allow me to create a agent, like a chatbot, that will sit on any patient organization's website and use AI to answer and have a conversation with anyone about their website. This is really important for a lot of people because I think if you have a look in the world, there's something like Lupus GPT is something that people have talked about a lot, which is a place where a patient or anyone can ask a question and the people who are behind that organization don't need to worry about what is going to be shared with that patient. So is it going to be some wild advice, or is it only going to be contained to the information that I already share to the world? So essentially, I'm going to show you how you build something, and then I'm going to show you how easy and fun something like this can be. So my ambition here is to empower you to feel confident about building something that you might have previously been nervous to do. I'm not a coder, but this year alone, I've built and launched over 50 websites without writing a single line of code. And so I'm going to teach you this, and hopefully you can have some fun with it afterwards. And then the thing that I'm teaching you to build, I think will also be useful for you as well. So how would I approach the challenge of building an automatic bot that will live on my website, that will use all of my information from my website only to be able to help a patient? And how do I do all of that in AI? And I'm going to, within that, allow it to accept PDFs on top of your website existence, and also to write guardrails so that it doesn't ever make anything up and follows rules that you have. So hopefully you're all with me. And I'm going to do it live so you can see how quickly these things can happen. The intention isn't for you to learn to copy exactly what I'm doing. It's about showing you the different tools and speed with which you can build something. So, team at World Patient Alliance, if you don't mind, can I share my screen? Perfect. So whenever I am going to build something, I use ChatGPT as my base camp, right? A place that I always go to first, and I really encourage people to do that. I treat it almost like my coach, and it can do many things. And I'm going to just show you that here. So this is a ChatGPT screen where hopefully most of you are familiar. I do use a paid version, and the idea here is for me to use it as a coach. And so if you wanted to build something, my advice to all of you is to press this voice button and talk to it. And this would be an example of what I would do. I would like to build a website where I can put my website link from another website for you to read it, digest all of the data, and I want to be able to create a embedded chatbot that I can put on my website where people can ask it questions, and it only uses the information restricted to my website or any additional PDF information that I upload. And I also want you to know that this is for a patient organization, and so I want it to have guardrails so that I never ever communicate anything that is negative or inappropriate. And I'd like to have default answers where you just don't know so that you don't make anything up. Can you give me the full one prompt to build this entire website on Replit? So all I've done is like have a conversation about my need. This is what I would like to do. I use voice because I find it much more natural a way to actually get a conversation going. And AI likes to be in communication like this as well. If I type, sometimes it's too slow. My brain is going too fast. And it's okay as you're talking to correct yourself as you would in normal life. So if I press yes to that, it now understands that I want to build a website. There's one word I used here which you might not know, and that's Replit. Replit is one of many websites that you can build things on. And Replit is what they call a no-code platform, which means that you can build software, web applications, mobile apps without ever knowing or understanding how to write a line of code, just understanding what it is that you want to build and say. So what ChatGPT does now is uses all of its knowledge to understand what it is that I want to build. And you can read what it's doing. And many experienced people do like to do that because it's a way of knowing if it is, oh, sorry, typically clicked the wrong button, right? So what it's done here is give me all of the detail to build what I need. So you can see it says here, copy everything below into Replit as a single prompt. So what it's doing here is thinking, and doing magic. Everything like, how do I want it to look? What does a website normally need? How do you optimize it? How do you do search engine marketing? Everything you could ever think about, it's assuming that you want it to be there. And all I've ever given it is that voice instruction. What you do after that is you copy the code here and you open up Replit. So Replit is another platform and it's replit.com. And all I do here is I paste what ChatGPT gave me. I haven't had to think about anything. It's still writing and it will take about 3 minutes. And what it's saying is, I'm going to build a website which is going to allow you to put a website in, let your user do this. And in 3 or 4 minutes, it will give me all of the code, which I put into here, and I can start a chat with it. And it wasn't complete. And what this website does is takes what ChatGPT gave me and turns it into a website. And it starts working automatically. And you can set any sort of challenge where you think you might need a website or an app or application or anything that makes your life easier. It might be, I want a website where I can coordinate 100 volunteers for a charity walk. Please, can you create me a website where everyone can register and they can upload their donation and they can share their photographs and we can share with them a certificate. It would do exactly the same process here. And then here it says, would you like to see the design or would you like to see the whole app? And if you press the whole app, it starts building it for you. These things are becoming extremely intelligent. Not only will it build what I've asked it to build, it will employ a designer, a technical architect, and a quality control tester to make sure that what it's building is done correctly, beautifully, and it's technically correct. And you don't need to do anything else. And it just starts working for you. And so I really would love you all to open up ChatGPT and have a consultation with it about something in your mind that you want to build, which can be simple or complex, and give it a go, right? It doesn't do it perfectly all the time. And what you have here is a question box here where you can say, I don't want it to be blue, I want it to be green, or this doesn't work quite how I wanted it to work. And it's quite crazy that's in about 7-8 minutes, it will be ready. I'm not going to make you wait. You really would be bored of me. But what I'm going to do is show you what it built for me before. So
Ravi, in the meantime, there's a question, is Replit a paid app?
It's not very expensive. It is paid. There is a free subscription. There are other ones available like Lovable, and we will share with you the full list. But what you're looking at is $50 a month will give you the equivalent of a software development team, which would normally cost you £50,000 a month, to put it into perspective. Yeah. So I wouldn't worry too much about it. So off that same prompt that I did earlier, this is what it built me. Right. So this isn't a trick. This is literally the exact same thing it will build over there. And this allows me to create a bot, right? So it can be the World Patient Alliance, right? Or something. I'll run a quick one. Yeah. So and in here, I can put the website of the World Patient Alliance. And anyone shout it out for me? Is it just worldpatientsalliance.org, right? Yeah. Yeah.
www.worldpatients,
Worldpatientsalliance.org. Yeah.
patientsalliance.org.
Got it. Okay. So all I've done is I've shown you a minute ago how I built this website, and this website now does the following, where I type in my web address. I set here some safety guardrails. Always be clear that the information is general. Do not offer opinions on specific doctors, etc. All the rules that you would want to make sure that you don't give bad advice. And then you can upload PDFs, and then you can just build this. And what this is now doing is going into the World Patient Alliance website, taking every single piece of information that's in there and turning it into a bot where you can have questions. Now, I wanted to show you this from a patient perspective. And so I have a website which we built, which is we built a website for an imaginary illness. So you can see it here, right? So this is a fake patient alliance, a fake patient organization where people have symptoms like laughing and itching. Yeah. And this was created just as a mock so that you could see it, but it has all of the standard information that you can see that a patient organization would normally have: symptoms, treatments, getting support, volunteer research, resources, etc. And what I've done with this, and sorry, this is slightly technical, but it's important, is I built this bot called Laugh. So if I go into the bot Laugh, I read the website from it. I didn't upload any PDFs, and it built me a bot. So I can ask it questions here. So this section here, your question, ask anything about this website. I can say, what are the symptoms? And it reads the website and will give us an answer of what the symptoms are. Normally, yes, right? And so here you can see the symptoms of my made-up disease can vary, but they include intense cycles of itching, episodes of laughter, etc. And this is me feeling 100% confident that I have built a simple Q&A that people can interrogate my entire website, every PDF, everything within it, and only answer based on that information and listen to my guardrails. And what's interesting here is that this, for those of you who know about websites, that small line of code can be put into your traditional WordPress website or Wix or whatever you're using, and that chatbot at the bottom would live there on your website forever, allowing you, your patients and your audience to interrogate your entire website in a natural language way, which is what many people want right now. In terms of understanding, well, we're a health organization. How do we make sure that things aren't made up? How do we give correct advice, and how do we move forward with AI? And so what that means is that people will be coming to your website to get advanced information instead of going into AI, where there's unrestricted conversation about anything. And so I'll summarize what I just did. I'll stop the screen as well so we can see me. In 5 or 6 minutes, I showed you how something that's living in your mind can be built into a working web application of some real serious intelligence, that in just a few minutes, we were able to say, this is the only information that you're allowed to analyze, plus these PDFs, and I want you to talk to anyone about it in a really natural way. But if someone asks a question like, can it kill me, or something like that, it gives a very, you must go and speak to your doctor reply. And a lot of people think these things are complicated, and I really think it's important for you to know. Can I have the screens back up? Sorry, Ramesh, yeah? The slides, yeah? I can't see them for some reason. Yeah? Perfect, thank you. Yeah. So I want you to not be frightened of using AI for adventurous things. Building something that might be useful. That could have been a website for a conference, or where build me a conference website where people can register, they can receive the dates of the information with 3 emails before, letting them know what's happening, and I want to broadcast the event onto that website afterwards. You would get a working coded platform within half an hour, and it would be very, very interesting, and absolutely we'll share everything there with you. So when you say it lives in Replit, are you using the link for the homepage? I'll explain to you. I mean, I did that as an example for you to see how quickly things can be built. But what I've just built there is a really simple website that will allow you to get a line of code that you put on WordPress that would, and you can design it however you want to, that will then sit on your website. You would need to keep the website that I've just built running, because that is powering everything up in an automated way. It's constantly reading your website. It's constantly seeing anything new that you've added or taken away. And so that the information that's going into that little chat box on your own website will be accurate, up to date, and in line with your policies, ethics, privacy, and safety. And so I think everyone is going to have that within 12 months. And I think many of you will be approached to buy it from someone. And there are tools online that you can buy something like that, and it will just do the job for you. But when something is that simple, why not give it a go yourself, right? You know, there's quite a lot of joy in this adventure, and you shouldn't be frightened. If I could go to the next page, please. We go to the next one as well. I talked all of that through the prototype that we worked on. Could you change this slide again? I've put in here some things for you when you receive this presentation. So, whenever you're writing something for yourself, you must put guardrails in. This is information only. If you're not sure, please reply, I'm unable to answer this. It should be given from your understanding that everything that I'm talking about here can be done in any language. So when I was opening up ChatGPT, if I spoke in Urdu or if I spoke in Spanish, everything else would still be the same, and the process is exactly the same. It just understands. So have a look at these guardrails as you build your projects. I don't want to try and second guess everything that you might want to build, because it's the full spectrum of options. You can, automate your email, or you can build a website for the next 3 years of running your agency. That it's that broad. But I'm pretty certain that many people will have ideas of things that they want, but they can never get enough time. They don't know how, or it's too expensive. This type of experimentation deals with all of that. It's not for everyone, I know. And so even if at a minimum, I help you not to overpay for these services from other providers, then that's a good job as well. All of these things are possible. They're easier than people think, and you've got to give them a go. If we can go to the next slide, please. There are so many different things that you can build here. That if you wanted to have a pathways website, so I want to build a navigator, or I want to build steps for people to manage it. All of these things can be built, and you can also upload your logo and color scheme so that it's all done in a beautiful way. It's no need to worry about everything looking boring or anything like that. Everything is possible here. If we can go to the next slide, please. And so I'm going to move on to the second live demo. I wanted to make sure that I left plenty of time for questions for all of you as well. So I'll go through this quite quickly. How much does it have to cost to be on your website? I'm going to answer that question. So the things I just showed you, you have your running costs of your AI, ChatGPT, $20, Replit, $20, $25. And then you have your OpenAI connection. And so everything I'm showing you is using some level of AI, and the cost of running it will be a few dollars a month for you. It won't be any more than that. But within it, you also get all of the AI access to your tools and things like that for other purposes as well. So I think the cost is almost negligible, and other people are trying to charge $1,000 a year for something like that, right? There's no need. You can build these things yourself, or work closely with someone and explain, look, I know this is possible. We can use this, this, and this. And it's really solid. I think that over the last 20 years, my entire career has been focused on technology and creativity. People have always been assuming that things take time in technology development. They really don't, right? And so encourage you all to jump in and not worry too much about the costs. And I fully expect, and I'll be working with Andrew and Dr. Jaffrey and everyone to make sure that all of the providers can continue to support not-for-profits around the world. They just haven't got around to it in making it free, but I fully expect with the pressure that we start to put 3, 6, 9, 12 months, we will be able to get some of these things for free. And absolutely, you'll have the recording of this will be on YouTube, and you can have it afterwards. I do know that I spoke about a technical area, but I really wanted to inspire you to have some fun and joy in building things, and at least be knowledgeable about it. The next thing I'm going to talk about is, okay, so really important question around job opportunities, right? And we've noticed over the last year quite clearly that there is a risk that we're taking jobs away by using AI. I fully expect a whole new world of jobs to exist. And I think that everybody is free to make their choices. If you want to continue using your web development team to do this, of course, that's fine. But unfortunately, some of the things that I'm showing you are only possible by using AI. It is only possible to have that natural language chat with AI without, and it feels like a human. So some of the things will be there. Right, I'm going to show you one of the things that everyone talks to me about quite a lot, which is using AI to create campaign images. And it's I think the thing that most people take as a first step. You know, can you create my social media images for a campaign? And the answer is yes. How do you make sure the information is ethically sound? I mean, that is something you're doing anyway. So, as a patient organization or an advocacy or a clinical group or someone, you spend most of your time in making sure that your information is accurate. And what I've just shown you there is that it's only going to use that information alongside the fact that people like OpenAI themselves are changing their policies to make sure that the answers and information shared with people is in line with approved education and awareness material. I think we're only going to see improvements there. But if you allow me to share my screen, I just wanted to go over this one thing because so many people have asked a question around it that it's important I answer it. So I'm just going to set it up here. So this is the website for the made up disease that I created, and I've just copied the link for it. And what I'm going to do is to go back into ChatGPT and start a new chat. And I'm going to use my voice so that you can hear me and say, I'd like you to analyze this website link, and I'd like you to create a campaign for um, awareness of the symptoms amongst older people. And I'd like you to give me a prompt to create 3 images for a social media campaign for letting older people know about the symptoms of this disease. So, and you can mix voice and chat. So that's my voice, and then I'll just paste the link, and then I give it to it. And that's how easy you can really um, get things analyzed, right? And so it's analyzed. So it gives you a nice summary of what it's done. It's given you a nice campaign idea. It's given you the entire campaign, week 1, week 2, week 3. What do we do? And then it's given me here prompts for 3 social media images: spot the change, voice and throat awareness, and share with someone you love. So I would always have my consultation with ChatGPT like this, and I would say, I quite like the idea of that prompt 3. Please create the image for 3. And it starts to create it immediately. Um, and that's within the ChatGPT environment. And we use 2 or 3 other different generators for it. When you're using ChatGPT to create images, it's this creation of the prompt that is really important. ChatGPT is more intelligent than me. And even though I'm creative and smart and experienced, I still am always in a rush, or I haven't had time to think about it as much as AI. And the prompt it will create you for the image is here. A graphic for social media. 2 friends aged 68 and 72 laughing whilst walking in the park. One is subtly pointing to their throat. I would never take the time to write that. But by asking ChatGPT to come up with it, it sets off the tone to hopefully get a really impressive image. And many people are not using ChatGPT to that advantage. And this will be done in a second. But a lot of people, when they did this and tried it, were finding that artificial intelligence is not very good at mixing words and images. And often in your post for social media, you will have an image with something written on top of it. It might just be your logo. It might be World Psoriasis Day or World Axbar Day or something like this. And so how do you get that right? And I wanted to show you how we do it. And it's on Canva, which I don't know how much you know about Canva, but we've mentioned it a few times. And so what we do is I'll just wait for this image to come down. And it's a couple of minutes for an image, and we will download that image once it's ready and put it into Canva. And in Canva, you can create social media assets, and you can pick an Instagram post, and you can pick the post, and you can upload any image that you've previously uploaded. So I'll try and find something that I've done. So it's my mother and my daughter's joint birthday party. So I created a photo of them both, and um, you can just reframe it however you want, and you can add text on top of it, um, like a text box. And you can start typing, and you can change the images, you can add your logo and everything else as well. So if I go back, this was the poster that was made as a social media kit, as an example, within seconds of analyzing a fake website to create fake people to communicate awareness of a fake symptom. And I don't like the fact it's got all the words on there, so I can just say to it, can I have just the image, please? I still can maintain some politeness, and it will go away and recreate the image without the words. And then what we would do is upload it into Canva, where we can very, very easily add whatever we want to it in terms of words and colors. And this is a website that I think is extremely easy for everyone to use. Um, should you be getting stuck, as an example. And if I go back over here, it's now recreating the image over there. So I'll stop sharing there, and if you can go back to the slides, please. And the reason I did that is to really go through that process of using ChatGPT to carefully create detail, to then create images that can then be polished off in something like Canva, which is also free for not-for-profits and very easy to use. If we can go to the next slide, please. So hopefully we've had a good recap. Hopefully I've inspired you to go on the journey to do some more complex things, to understand the simplicity of the way things can work, and that small point on content, because a lot of people are using it for content and sometimes getting frustrated, but it's totally okay to finish things off in the old way as well. What do we see for the future? We definitely know that things like surveys, volunteer management, reminders, fundraising workflows, newsletters should and can all be automated. It improves communication. It gives you more time to do things that are perhaps more important for you. It makes sure that everything is done and digitally be distributed. I wouldn't be surprised if more than 50% of everyone on this calls activities in this area are, if they are not impacted by AI in the next 6 months, because it's definitely happening. It makes life really good. Internal knowledge assistance. This, I think, is something that not many people are doing. And where I showed you that bot, where I created a Q&A bot, that doesn't have to live with the public. Initially, you could offer it to all of your mentors, buddies for other patients, or volunteers to get used to the disease. So they can ask it questions like, so what have they done before? What have we done in the previous? Yeah. It doesn't make it a good life for seniors and persons with seniors. I mean, I think, and I'll come back to some of the questions afterwards. This AI isn't a magic solution that's going to solve everything in life. What it is a set of tools that is moving us forward to be more efficient, communicate better, allowing us to focus on some of the more important stuff that gets in the way. I think patients have 24-hour access to information and they can move forward. And people like volunteers who often join a patient advocacy group haven't been trained in the disease themselves. And so I think over the next year, we'll see a lot more internal knowledge assistance happening. And then I think we will definitely have AI agents doing lots and lots of things, preparing reports, analyzing meetings, drafting briefs, scheduling and following up things on your behalf, and real-time multilingual communication happening everywhere. So I see the next 12 months as being very interesting, where people take some of the things we've been talking and start actioning them and start building these types of tools to improve the organization's nature and flow. If I could go to the next slide, please. Yeah. We've covered that. We can go to the next slide. I do expect OpenAI and everyone else to have some change, to have some changes in policy as well. So we all need to be keeping aware of what everyone's doing. I've really enjoyed these 3 webinars with you, and I'm leaving time for questions. Um, I I can't believe over 500 people have joined these webinars, right? It shows that people are interested. Yes, we have lots of questions that are unanswered, but for sure, it's great to have started the journey. And if you haven't done much, um, have an experiment each week. It really works well. So from now until January, try one thing a week, create an image, create a newsletter, create a whole web application that will give me a chat monster, whatever you feel like, whatever's in your mind. I definitely think that you should have an experiment. And I think as you get used to prompts, so the things that we write down to ask ChatGPT, firstly, use your voice. It's definitely better. Secondly, keep them, copy and paste them so that you can reuse them. Things that you liked, if something worked really well for you, then you should have that library, and which is why we've been sharing some of our prompts with you as well. I definitely think you should all be looking at your digital presence and updating it, making sure that you're ready. Start to use small automations here or there to improve your life. One of the ones that I use recently, which I haven't talked about before, is something called Gamma, which is a presentation maker. And it speeds up the time I need to create a presentation by 95%. And these things are always coming, and you should look out for them, because there will be things off the shelf that you can use at very low cost that will help you. Please, 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 all of you collaborate with each other. There's a lot of shared knowledge, and if you've built something for your patient group, it may well be useful for somebody else, which is where the World Patient Alliance creates the beautiful forum for all of us to connect and collaborate. I really know, and ideally at some point we might well share some things on the as the year goes on about learnings from each other. Don't forget about safety, ethics, inclusivity. The experimenting will keep you confident, but you're not alone. Speak to each other. I already know a handful of people that are on this call that probably know a few tricks that I don't know. And so please share them, and keep in touch. And we are here if anyone wants as well. So on that note, I'm going to leave it there. We are an agency that provides creative impact. We've already spoken to some of you who've reached out. We're not on a sales mission. Our door is open. Please feel free to contact if you have a detailed question. Yeah. And I think on that note, we are at the end of 3, so we can turn to some questions if that's okay. I'm going to just go through some of the questions. Can we trust blindly? No, definitely do not trust anything blindly here. I take care to learn, understand how it works, and to take the steps to improve things. Our role is to make sure that people eventually can trust some of these things blindly by making sure that the information we share and education we give and awareness we raise is accurate and is digital. The free versions can be enough. Absolutely. Don't think you need to have a Ferrari version of AI. Please start on all of the free services, and just make sure that when you're using free services that you are in a private mode, so that everything that you're sharing on there is not going to be used by the public. There was a case when AI was in its infancy where everything that someone was writing in ChatGPT was being shared as a Google search, including everything private about their life. That doesn't happen now, but I still encourage you to, just whenever you take on a new tool or a new platform, to make sure you click the private button, because their default answer is to share it. Yeah. Is it possible to add another website links to sources to them? Yes, absolutely. Yeah, it wouldn't take me more than 2 hours to scrape everybody's website on this call and create a master Q&A prompt. That's how crazy AI and technology has got now. Things can happen at lightning speed. You obviously need to respect your local laws on data privacy, etc., because scraping somebody else's website is not necessarily legal everywhere. We will share the guardrails, absolutely. Can the chatbot show the exact location? Yes, absolutely. What I showed you was brought in minutes. And if you really were going to launch, if you were a global agency, a global platform, patient advocacy group with 45 local country there. You would want to take some care in building this as you would with anything, do some surveys. It's not all about being AI. You still want to find out from people, what do they want? What would they benefit from? And, build something together which has got a lot of care built into it, which can be things like unique things. We want links so people can come off the bot and go off the page. Everything is possible. It's digital is literally just mathematics. It's what we tell it. And so if we say there is our database, there is our database, right? It doesn't go elsewhere. So making sure that we structure and plan things properly is always a good thing. As we embrace some of these, could there be some options for open source? There are many, many things that are free. Open source is perhaps not the right way to launch it, because there is a real cost here. There's an electricity and a power cost. So whenever AI is working, it's open source. You can download something, and then whatever you do with it is based on your own power consumption. So sometimes people forget that because AI has to live in a digital cloud, the people operating that have to pay that electricity power cost, which is why we get charged. And it's fractional, but there is a real cost there. And so I definitely think explore the free things, explore the low cost things, and keep up pressure if any of you are ever involved with the pressure to make sure that not-for-profits can receive the use of AI for free. Does it use African languages? Yes, absolutely. I am running AI projects in Rwanda, Uganda, Tanzania, and Kenya right now, and they are making a big difference. The language part of it is not the problem. The problem is about making sure that you adapt technology to your local culture. So in many countries, the mobile phone is the preferred option. QR codes are everywhere. And in some places, people are using laptops, desktops, more so. And so making sure that you understand your culture locally and adapting that to your AI strategy would be good. You can restrict the chatbot to internal documents. I'm glad we've got so many questions on it. I was a little bit nervous. It was a bit technical, but I can see from the questions, you're all thinking it. How can I harness AI to take all of my knowledge and use it properly? The things I've shown you, in order to restrict it to just PDFs that you upload, and then have a website that only answers those PDFs, is entirely possible. The reason I put the website link in there was not that it was freely available on the internet. It's just that one website, which is my website, which I will use to share with people. The software you mentioned for the presentation, Gamma, Gamma, it's an app that allows you to really, really quickly create a presentation. Unbelievably fast, accurate, and beautiful. And it's free to try, and I really would try it. Should patient organizations rather build their own LLMs with curated content, or train their members how to prompt? Both. I think that, in the same way you can't restrict someone accessing your website from a mobile phone, a desktop, or a screen in an airport or something, be agnostic to some of these things. Some people will want to write their own prompts. Help them write their own prompts. Some people will want an LLM that's been built for them to use. Build it for them. The word LLM is being used as a big thing, but really, I think we must make sure that we don't forget about the human involvement and what do humans want and how do they like it. And we're all different. And so trying to adapt to the different ways. Some of you in the audience right now would want to go away and try a prompt by writing it or using your voice. Other people may already have jumped on Replit and started programming. I often find myself writing an entire website on a train journey because it can do it on my phone. Some of you would prefer to do it on a website. So definitely, try and keep all options open if you're in the position of making decisions about how people will use your information. Try to have as many different options, because it's also relatively cheap to do as well. Can I use it to translate my interview transcriptions from audio to text in seconds? Vivian, please do try that. It's really, really quick and easy to do. We have 6 minutes left. Is there anyone got any burning big questions left to add to the list? No. Well, I am on LinkedIn. Ravi Ishwarupara, please do connect with me. I would love you all to be my friend. Uh, you can check us out, Platform Worldwide. Our website is platformcan.com. And in the documents that come out to you, our website and LinkedIn and everything will be there. But I will, because you've asked, I don't normally do it, I will share my LinkedIn in here. I really, really, we run our agency to really provide, low cost intelligence services, and we offer a number of grants to people we work with, but all the work we're doing with the World Patient Alliance is in partnership, and it's because of them that this has been able to be provided for you. We do it for free. And if you don't know it, I'm a patient advocate. I'm a cancer patient. I've been involved with patient advocacy work for a very long time, and I'm really, really happy to answer any questions and provide any support to absolutely anyone. So if I can get that live, I will add my link and look forward to making some new friends. And thank you to the World Patient Alliance for allowing us to do this. And was Lupus GPT built in the same way? Yeah, a similar way. Yeah, Lupus GPT is not magic. It's brilliant, but it's not magic, and we could build these things very quickly. And please, if any of you build something amazing, at least share that as well with me and with everyone else as well. On that, wherever you are in the world, thank you for joining. I've really appreciated this and look forward to 2026.
Yeah, thanks a lot, Ravi. But I also have a question, and that is basically, I think there were a mixed group of audience that we had. One who were quite, already advanced in using Chat GPT, everything, and the others, I think, probably were not very, fluent in this. So I was thinking of maybe we can develop some videos or maybe webinar or something, but stepwise in small chunks, like, one whole session on how to develop this website, as you said, so we
Yeah.
can provide the prompts to everybody, so everybody simultaneously can then do the same thing on their own,
Mhm.
computers, and then we take them to the next step and the next step. So if we could just slow it down in maybe small videos, or how to create a graphic, or how to create a social media post, just
Yeah,
break them all chunks with
sure,
proper prompts.
sure. I mean, I think AI education is going to be everywhere, right? And whilst I'd love to sit at the top and say, we are the fount of all knowledge, we're not. I would definitely ask you all and encourage you to look on YouTube, TikTok as well, because there may be different people that people doing it in your own language, for example, right? So I will also find a good set of existing material that people can look at immediately on top of the prompts that we shared. And I'm sure that we can find a way to continually update people, whatever stage they're at, in order to use this. And the first two webinars we had, we went through some of those basic tricks and tips. So the guide notes that we sent out for that already hopefully are useful to people. But I'm definitely a big fan, and I'm very happy to do what is needed in order to make the world's patients a little bit healthier and happier.
Yes. So thank you very much. And we are very extremely happy to have run this important training webinar series on AI. How can patients, organizations use AI in their work? When we began this series, our goal was to simply, to help patient organization understand AI in a practical and responsible way. So the session one, as you know, we explored what AI is and why it matters for patient advocacy. And then the session two basically focused on tools that organization can start using immediately for communication, awareness, and daily operations. And today, in third session, we have talked about what's coming next, how to use chatbots and chatbot agents. So I think this has been very, very informative. So if all of these are available, so the first two sessions are already available on our website. If you feel we moved quite fast in session three, you need to go back to those sessions, go through them in the videos, and you can understand what about each steps. You can run those steps, simultaneously on your computers, and that will basically help you. And I want to really thank you, Ravi, a lot, you and the platform worldwide for conducting this training webinar series. This collaboration has been extremely, extremely helpful for patients around the world. And thank you so very much for your time and dedication to this cause of patients. We are extremely, extremely grateful to you. I also want to thank all the patient organization and advocates who joined us from around the world. And they were in hundreds and hundreds of you. So thank you very much. So as we conclude this series, I encourage you to please continue using the guides, tools, and recordings we have shared on this webinar series. So these are available on our website. Please take a look at them, apply them in your daily work, and share them with your teams. And please stay connected with us. Your feedback, questions, and ideas help us design future programs that meet your needs. We're already in discussion with Ravi and team for our next training sessions on AI. So we definitely look forward to welcoming you again to our upcoming events. And thank you very much for your participation. Thank you, everybody.
Mm.
Bye bye.